The evidence continues to grow. There's more and more publications in peer-reviewed medical journals about the possible connection between vitamin D and COVID-19. So you've put together a presentation for us. Tell us about what your presentation is all about.
Yeah, thanks, Kyle. So we've been talking about vitamin D as a potential therapeutic agent for COVID-19 since March. And since that time, a lot of other people have become involved in looking at that agent as well. A number of research studies have been done. And the purpose of this is to sort of look at the evolution and the thinking of the use of vitamin D in COVID-19. So what we do is we look back even before COVID-19 and what was the evidence for vitamin D in acute chest infections, for instance, influenza, and what was the data there. And then we look at the epidemiological evidence for vitamin D as a therapeutic agent in COVID-19, and then finally moving along to actual cases, hospitalizations. And then we build up with that hierarchy of evidence with vitamin D and COVID-19 to randomize placebo-controlled trials, which of course are the gold standard for therapeutics.
There is a number of people that are at deficiency. Based on this, I feel not only is there a role for all of us to be taking vitamin D supplementation, at least during the winter months, but I also feel strongly that practitioners in the hospital may want to look at this in terms of their treatment of patients in the hospital. Now, I do not have randomized controlled trial data yet conclusively that shows that this works. But if we look at the risks of vitamin D supplementation and the potential benefits, I think the benefit to risk ratio is high. Dr. Fauci himself is supplementing with vitamin D. And while there are certain groups of people that should be very careful with supplementing with vitamin D, such as patients with sarcoid or other granulomatous diseases or patients with renal issues, without discussing it first with their doctors, I do see a role for supplementation, especially in this winter season when COVID is running rampant.